name is Mary Rose Day. My background is public health nursing, and I have a special interest in older adults as well, and I currently work at University College Cork in the School of Nursing and Midwifery. So I'm delighted to be with you here today, and I suppose just a few housekeeping things before we start. There are 3 exit doors, okay, for people. There are CPD points allocated for today's attendance here. And for people who wish to be allocated the points, the badges need to be handed in at reception before 1 o'clock, and then you can collect your papers at the end of the day. Also, the car parking is free underground, so again, that your card has to be stamped at the desk before you leave here today. And I would like everyone just a reminder, and in fact I must do it myself, to turn our mobile phones off. I actually haven't done it myself. So I suppose, you know, there are many challenges in relation to services, both public and private, and a lot of, so today's, you know, I suppose media attention focusing on it, on health and social care services and issues around it. So I suppose today, people, you know, there's a lot of very valuable and different presentations from the variety of sectors who are involved in health and social care. So there are opportunities for people to network with the people that are here, and to create links maybe for future work or whatever, and also opportunities to ask questions in relation to the challenges and going forward. So what I will do is we will take questions after each presentation. Also, there is a mobile number that people from the audience can use to identify a question that they want to raise to ask one of the speakers, instead of standing from the floor. And that mobile phone number, if you want to take it down now, is 087 145 2044. Now, without further ado, I will introduce the first speaker, which is Vicky Blomfield. And Vicky is with HIQA, the Health Information and Quality Authority, and she joined there in June 2008. Her background, she qualified as a social worker in 1991 and has worked for many years in child protection and the disability sector. She managed a team of inspectors, managers, when regulation of older people's residential services commenced in 2009. And in 2013, she became the head of Programme for Children's Services Regulation, which inspects children's residential care, foster care and child protection and welfare services. And she's designated in the designated centres for children and disabilities, special care units and detention schools. Vicky herself holds a Master's in Health Service Management from TCD and a diploma in corporate white collar and regulatory crime. Okay, so we welcome Vicky. So.
Thank you very much for the introduction, and good morning everybody. I'm going to try and avoid talking about the crime element here this morning. What I want to give you today is an overview of how HIQA works, what our responsibilities are, and how we use standards and regulations. And I think what most people often want to know is what it's like to have a HIQA inspection. And often people say, yeah, and I'd like to know how to pass a HIQA inspection. Unfortunately, it doesn't quite work like that, but we have a mandate to carry out inspections and to regulate certain services. I'm going to begin with a short anecdote. 70 years ago in 1945, Winston Churchill woke up to find that he had just lost the British election. and he sat down to breakfast with his wife Clementine, who commented that perhaps, Winston, it's a blessing in disguise. And he replied, well, it's a very good disguise. I think for many people, the idea of regulation, we should try and embrace it as a blessing. Many of us feel the disguise is quite effective. So who is the Health and Information Authority, or what is it? It's independent. This means that it doesn't report to a government department, to the Department of Health, the Department of Children, or the Department of Finance, to its funders. The Chief Executive Officer, who is Phelan Quinn, reports to the Minister and has to appear before the House of the committees of the Oireachtas. The Chief Inspector is a statutory officer under the Health Act 2007, and Phelan Quinn is also the Chief Inspector as we stand. Our mission is very much to drive improvement, to promote safer, better care, whether that's in the health services or in social care services, through health technology assessments or through developing health information mechanisms. However, there are times when we are driving improvement to minimum standards and to safety. This overview, I suppose, is at a fairly high level. But I want to remind everybody that it is the safety of our most vulnerable citizens who are living at home, who are in the care, sometimes the care of the state, and who are in hospital. And it should be a national priority that we all receive the highest quality of care. In HIQA, we're very interested in people's rights. And these rights are enshrined in a number of UN and European charters. And I think it's always important to remember how our services are connected. So what do we try and do? Our core aims, our objectives, are to drive improvement, as I've said, in services. We also inform the public about our services, and the main way in which we do that is through publishing reports. And so whether it's a report into the maternity services in Galway or the services in Portlaoise Hospital, whether it's a report into a 10-bedded nursing home in the west of Ireland, or into a service run by the HSE, a large institution, or a large centre for older peoples, we publish our reports. It's rare that we don't publish a report, and sometimes we don't for reasons of confidentiality. We inform policy, so we talk to government departments, we talk to the HSE, we talk to the Child and Family Agency, and we engage with private providers, and we very much try to take initiatives that will improve things. So a couple of years ago, I was involved in a working group that developed a policy called Towards a Restraint-Free Environment. And that was a national policy. And HIQA, in those situations, go on working groups. We produce overviews, and we try very much to influence the direction of health and social care in Ireland by our health service. So if, for example, a hospital delivers X number of hip replacements, does it ask patients 6 months later, did it work? And we don't very much. It's not just quantity, it's very much quality of care that we should be looking at. Okay, what is our role? What's HIQA's role? We regulate designated centres for older people, for children and for adults with disabilities. We are engaged with about 1,500 centres. We also monitor, and monitoring is slightly different. Monitoring doesn't involve registration or enforcement. it involves very much looking at information and carrying out inspections. HIQA needs to take emergency action in terms of a service. The section of the Health Act actually states that we can do this because there is a risk to a person's health, their life, their well-being. A significant risk. We also want to say to providers, this is what a quality service looks like. This is one that works. And we see excellent practice, and we've commented upon it. We see exemplary centres where residents have interesting, meaningful days, not just activities, not just the work of an activities coordinator, but people whose lives are actually rich through every moment of their day. And who do we work with? We work with, without, if you like, fear or favour, to public services provided by the HSE, services provided by the new Child and Family Agency, and private providers of services. I think when we began regulating, there was a fear that regulation would only be directed towards private providers, as it had been previously, and this is not the case. So all services, whether you're struggling with your budget or your bottom line, we have to say experience the same scheme of being open but being safe. Maybe, yes, it does produce a confusing picture. What inspectors like is writing a positive report, if you like, catching you being good. That is the easiest report to write. If you've overwhelming evidence that a service is unsafe or of poor quality, you have to be very careful, you have to be very rigorous as an inspector, but it's not the worst one to write. The good in parts, like the curate's egg, is the most difficult inspection report. The absolute foundation of any good service is the root cause is leadership, governance and management. And I absolutely believe this. There is what their life is like. And we talk to them, we talk to their foster carer. We go to meetings. In child protection, we watch phone calls, we watch the duty room, we join key meetings. We go to an awful lot of things, staff handovers, we might even go to training sessions, and the powers of the regulator are extreme, actually. So providers can't refuse us unless there is a particular reason. Providers can't refuse documents to us, and it's an offence to do so. So if you look at that, we actually have more powers than the guards, more powers than customs officers to remove documents and take information from people. That actually is a very weighty responsibility for inspectors, and what's very important is that we exercise, if you look at a report, and I can say this is a good or a not so good service. But it's also the public has a demand, if you like, that poor practice is identified as well as good practice. The public, our society, is highly intolerant of errors made by the regulator. If you look at a case like Baby P in England, a child in Harringay, or a child the subject of a serious case review in Birmingham, if the regulator gets it wrong, if the regulator says this is fine, this was a good service, and for instance a child dies, not obviously because a social worker went out and killed them, but because many services were involved and the risks to this child weren't identified or addressed. And what can happen then is regulation swings. And so Ofsted, the regulator for children's services, has carried out recently 40 inspections of child protection services across England, and has not found one which exceeds the standard to which they give their top rating. And you would worry that it's because they are afraid to give the regulator's biggest fear, the false positive. But you can also say, and I'm going to come on to this, that it isn't fair, and it isn't fair for providers if this is the case. How do we make judgments? We gather evidence. I'm going to talk again about what that evidence looks like. We make recommendations, or they can limit, and as well as form then a judgment of. Enforcement is the place where you don't want to go. It's where there is continued findings of risk or critical risks identified in the service. And HIQA can cancel registrations, change the conditions of registrations, look for enforcement orders from the court, look for take prosecution, and there are different ways of cancelling registrations, but it is very much a last resort, because when you do that, you are taking away a service from people, and we have to be very mindful of that. People lose their jobs and their livelihoods if they're in the private sector. It's a very serious thing to do. I have only a little bit of time left for questions, but I do have some time, so I'm very happy to take any questions that people have at this point in time.
So we just have a few minutes, so any questions? Thank you very much, Vicky. That was a very informative presentation, and I suppose since 2009 there's been a vast range of activities, and if anyone has visited the website of HIQA, there are a huge amount of resources there, and I would advise anyone to do so if they have not already done so. Any questions? Okay.
Hi, is there any indication of regulation coming down to the home care providers?
It's not HIQA's decision, it's a government decision. And the government has to decide whether they are going to resource this. There's a run-in period where standards are developed, regulations are drawn up, the number of providers are identified, and then there has to be an enactment, a commencement of the legislation for a particular provider. There's discussions about it, there's talks about it. It will totally depend when it becomes a government priority.
There's another gentleman there, you had a question as well. Third.
Thank you, and thank you for the presentation. Declan Murphy, CEO of Homecare. The first part of the question was what the previous gentleman spoke about, but I was also interested in the process in that, and especially the actual time scale. Obviously, there are standards there for home care delivery all around patient-centred care, and it takes time for those standards then to be put on a sort of a statutory basis. And given that it's on the horizon somewhere, when you think about the Law Reform Commission in 2012 specified that these would come in 2016, that's literally 12 months away or less. What is the sort of the standard process, even if you think back to the nursing home standards from start to finish, how long did that take and how long can you expect?
Develop standards. I think it takes at least a year. I was involved in the development of disability standards and particularly child protection standards. And what happens is there is a process where a team in HIQA do a literature review and look at standards in other jurisdictions and produce a set of draft standards. We have an external advisory group that would which would include members of all types of provider, as well as statutory agencies and other relevant parties. And they would then input into the draft standards, and then those standards go out for a wide consultation, a public consultation. You have to analyse the findings, you produce your final drafts, those go to our board and go to the department, the relevant department, and then you get your final version, which is signed by the relevant minister. So there is a defined process, and in terms of the child protection ones, it took a year. And also they have to be congruent with any regulations. So you can't have the regulations say one thing and the standards say another. And that actually did happen in the older people's standards. There were some small issues, but you know, it then makes everything difficult for everyone.
Thank you.
Sorry, Ms. Gentleman.
I was wondering, obviously HIQA would be an advisory capacity to government in relation to... Obviously HIQA would be an advisory capacity to government in relation to any home care packages being put forward. And I was wondering, have HIQA looked at any models or standards in any other countries that you feel may be applicable to this country? Or
HIQA actually doesn't promote any particular model. So, say for instance, some nursing homes have taken the Tyler model of care. We don't say that's the model to go for. We say, what is it like for residents living in the particular centre, whatever model they have. So we don't promote a certain type of flooring, we don't promote a certain type of mobility aid, we don't promote a model of healthcare. And also because best practice changes all the time. Models develop all the time and improve. And if we have a set of standards that last for 5 years, they'll be out of date. So we don't actually do that in the same way that we're not involved in the funding mechanisms. And that's been very difficult because will the government give enough funding for services to meet standards? But that's actually, even in times of austerity, not our business.
Okay, thank you.
Okay. There's a lady just there. Yes.
Good morning, thank you. My name is Nola Crowe. I'm General Manager of Fonsecourt Care Village in Cork, and I'm used to dealing with HIQA. I suppose we've had HIQA inspections since they started. I suppose if I didn't know HIQA from your talk, I'd be afraid of my life, to be honest with you, but all I can say is good things about HIQA. They come in and we have the same agenda. We want what's best for our residents, person-centred care and a safe environment. I would say, I suppose, like all of us, I suppose HIQA is a work in progress in the sense that I suppose we would see that our administration has increased, and I suppose I'm in my position 5 years, and I would see that I constantly seem to be running faster to stay still, and so do all my staff, and a lot of that is to do with administration, I feel, and I suppose, like I was talking earlier to someone, residents and relatives' expectations as well. We have to make sure that all our boxes are ticked and that we have answers and that we have backup for everything we do and in a safe environment. But I would say that, I had an experience, the last inspection I had, it took a long time to get beds registered, and I did put it in to say, look, please try and improve it, because on the one hand you have people in hospitals trying to get out of beds, and we have beds empty waiting for people to come in, and you're losing money. So I suppose that's one thing I would say, if you could put in a word to see could it be improved or speeded up maybe, and just to keep an eye on the administration side of it, that we can kind of keep the timelines down, that I suppose spend the time with the residents rather than in the office doing paperwork. I suppose that's what...
And I truly do appreciate that, and I think one of the things that we take cognizance of is a report that came out a few years ago about the regulatory burden on providers, and that it should be reasonable. On the other hand, I argue with people sometimes, it's been in child protection, or we have to fill in all these forms actually for, as part of the Child and Family Agency's business processes. And I'm saying, well, is it forms you're filling in, or are you making records? Making records that other people need to develop care. And I think we just have to be very careful about that. Regulations say you have to make notifications, for example. That's a regulation, you know, so it's a rule. In terms of prioritising new builds and new beds, I would say we try to, but there are a lot of competing demands, and particularly if we're engaged in enforcement actions, or how we target our resources. But I completely understand that if you have a new build, you've invested a lot of money, or if you've extended your facility.
Yeah, and I know I'm not going into personal things, but it was an extension of 2 rooms. But the day HIQA left, we had new people in those rooms because they said you can move, but I had to keep 2 others free. So it doesn't make sense to wait till I get a search, which was nearly 2 months later. But, you know, that's, you know.
There is a legal process.
Yeah, I know.
And, you know, that's in the Act, unfortunately.
Thank you.
Now, thank you very much. We'll finish it there because I want to keep the conference on time and everything. Thank you very much, Vicky. A little round of applause for Vicky. Vicky will probably